Okay, welcome everyone. My name is Sarah Stoddard, and I'm the co-director of the Training and Education Core for the Injury Prevention Center. And Taylor's also here with us today, and she really manages a lot of the training and education activities through the center. So she's also a good person for you to know and interact with. Today, we're going to talk a little bit about our summer internship program. And I'll kind of run through a more kind of planned presentation, and then we'll have time afterwards for question and answers. Okay, so I always like to start out with some definition of, what is injury. So the definition on this slide is from the Department of Health and Human Services and the CDC, and this is the way that they think about injury. So it's really any intentional or unintentional damage to the body from a number of different kind of mechanisms. And you can see kind of some of those examples here on kind of our little diagram, our graphic. So, things that are included in injury are child maltreatment. We actually include substance use and misuse as a type of injury, concussion, driving related injuries and motor vehicle, suicide and suicide prevention. So those are just a few, and you can see other examples there. And then why do we care about injury? I think it's important to really remember that really most injuries are preventable. And, many people, you probably know people that have been affected by, whether it's violence or other types of injuries. You may know someone who has kind of attempted or committed suicide, or someone who's been in a car accident. So all of those are kind of preventable. And, death or injury is one of the leading causes of kind of morbidity and mortality. And so many people are affected by injuries and do survive and are faced with kind of lifelong mental, physical, and financial problems related to those injuries. So I think, like I said, we like to think about, well, how do we prevent then those injuries? So as I mentioned, unintentional injuries, you can see here, is the leading cause of death for ages 1 to 44 years old. And it is still a top cause of death for middle-aged and older adults as well. And then, suicide, homicide, particularly for adolescents and into young adulthood, are also top causes of death. So we are one of the injury control research centers funded by the CDC, the Center for Disease Control and Prevention. We've been funded since 2012. I think I mentioned we're one of 9 centers across the country. You can see where they are on the map. Many of us are kind of located more on this kind of the East Coast. And the focus of the injury control research centers are, it's really threefold: research, outreach, and training. And today we're going to talk mostly about kind of one of our training activities. So in our centers, so each of those 9 centers might focus on different aspects of injury and injury prevention. This slide really gets at the focus areas for our specific injury prevention center. So we do a fair amount of work around opioids and overdose, suicide, violence, concussion, motor vehicle crash, older adult falls, and then we have a few faculty that have done some global injury prevention work, particularly in Africa. And then we have a kind of a little category of ACEs, which, if you don't know what ACEs are, they're adverse childhood experiences, and kind of other emerging areas. It kind of gives us a little bucket to kind of continue to maybe expand as other maybe injury related topics come out, or if we have faculty that join us that kind of work on other aspects of injury. But, most of our work really do fall under these 7 categories. So a piece of the training and kind of what we do around training is to prepare students for careers in injury prevention. So we do this in a number of ways. The summer internship program is one of them. If you've heard, we have a certificate that we offer through the School of Public Health. We're not going to talk about that today, but that is an option to kind of gain injury prevention experience. There are a number of courses, both in the School of Public Health and across campus, that do touch on topics related to injury and injury prevention. But some of, like I said, our goal in our training and education core is to prepare students for careers. And so on this slide, it gives some examples of different careers, different locations that you could work in injury prevention. So there's often opportunities at local, state, and federal government levels, whether that's federal, like at the CDC, or the Michigan Department of Health and Human Services, or at a local or city, county, or county health department. There's a number of nonprofits and academic centers that do injury prevention work, hospitals and health systems. And then there are opportunities in the private sector, whether that is through kind of working on and maybe developing interventions or doing more research related to injury prevention. So there really are quite a few and different opportunities out there. So now I'm going to talk about the summer internship program for the 2024 summer. So this summer, we are going to be supporting 5 interns. Typically, the majority of our internships are for grad students, graduate level students. We do often maybe have one position, 1 or 2 for an upper level undergrad student. We kind of offer experiences, and the internships really get both at experiences in research and experiences in practice. One of those experiences is at the CDC or affiliated with the CDC. And then our internship is set up in a way that it can be used for the MPH program practicum internship. So we do, and if you are an MPH student, we like to know that, because we can also look and work with your mentor or preceptor to make sure you're kind of meeting some of the competencies that you want to for that internship. So eligibility for our internship program is that you are either a grad student, and then you must be enrolled still through December of 2024. So if you do our internship over the summer, it means that you will continue to be a student fall term at least. If you're an undergrad student, you need to be either a student that's growing into their junior or senior year of their program. And then we really do, I mentioned that there's one CDC placement, and that is kind of restricted to being a grad student in public health, are those that are eligible for that placement. And then you can be a student from any accredited university, but we do give preference to University of Michigan students, but that does include Flint and Dearborn campus students. Here are some kind of ideas of where we've had placements before and where we may also have placements this summer. So some of our students in the past have worked on projects right within our Injury Prevention Center. Some have worked with other centers on campus, the Concussion Center, the Prevention Research Center. We've also had placements outside of the university, that Detroit Health Department, Washtenaw County Health Department, the Michigan Department of Health and Human Services. We've sometimes worked with other local, maybe nonprofit organizations. So those are all kind of ideas of different opportunities and different placements that our students have had in the past. One student will be connected with the CDC for their placement. Previously, prior to COVID, that was always a Atlanta placement. So you would spend time at the CDC in Atlanta for the summer. Since COVID, those have been more remote positions, but we will have a better sense of that probably a little later this winter, whether the CDC will have the interns come to Atlanta or not. I think if you're interested in the CDC placement, I think do think of it as that you need to be able to go to Atlanta for the placement, but it is possible that it could be a remote placement with maybe a shorter stint or period of time in Atlanta. They've talked about doing some different things with interns. And then that CDC placement is for public health grad students at U of M only. So the responsibilities and expectations of the internship program is interns are expected to work at least 318 hours. That's about 25 to 30 hours a week, kind of over 2.5 to 3 month period. That schedule is really negotiated between you and your preceptor. So what hours that looks like, where you're going to be, those things are kind of more, there's some flexibility to that, but the expectation is, about 25 to 30 hours per week. You are required to complete the injury prevention massive online course that we have that's focused on child and adolescent injury prevention. We have students attend our seminars. It's about every other week. We have a seminar that you would participate in. Some of the seminar topics are more related to content related to injury. Some of it is more kind of career and professional development related topics. And then at the end of the summer and kind of early fall, we do ask the interns to do a presentation about their experience. We offer stipends to our interns. It's a $1,900 stipend per month for 3 months. So it's a total of $5,700 during the summer. The student that is selected for the CDC placement, if you do go to the CDC at all to Atlanta, you get an additional $500 for travel expenses. Applications are open. We are currently accepting applications. They are due December 18th. You can apply for both the local and the CDC placement if you're interested in that. You only have to select or do one application, and just note in there, and there's a way to select that you are interested in either one option or both options. And then we pair you with the placement. So what happens is we're talking mainly about kind of you as a student today, or the students that apply for the internship, but we also have placement kind of locations and organizations apply to have an intern. And so then what we do is we look at our student applications, we look at our placement applications, and we do some matching, really looking for a placement that kind of that fits, that is maybe in a topic area or a skill area that the student is interested, that kind of matches what the experience is going to be at the organization. We'll review applications in January, and we'll let people know of decisions in early February. So the application components, there's some basic information, your contact information, the program you're in. We would like you to submit your CV or a resume. A CV is kind of a fancy resume. A resume is just fine. 2 letters of recommendation. We do ask that one of those letters be from a faculty member. And then a personal statement of 500 words or less. And that personal statement, really we'd like you to talk about, why you're interested in injury prevention, maybe what area or areas of injury prevention you're interested in, maybe what skills you bring and what skills you'd like to gain. Maybe a little bit about your career goals as they maybe relate to injury prevention. So kind of help us get to know you a little bit and what you're interested in, and maybe what some of your previous experiences are. So I'll just show just a couple slides from our former interns that talk about kind of their experience. This first intern did do their placement at the CDC. It was virtual CDC placement, but they really still had a really good opportunity and exposure to the CDC and an organization that does injury prevention. Our second intern was a more local intern who did their internship through the National Center for School Safety. You can read a little bit about their experience. Okay, so this is the website where you can find more information about applying for the internships. This is Taylor's email. You are more than welcome to reach out to her. We communicate all the time too. She can answer most of your questions really that you might have about the internship. If you have any questions about how to apply, or qualifications or eligibility, you're welcome to reach out to us. But the website also has all the information we just shared as well. And I suspect this video will also be there later. So I could stop screen sharing right now, unless someone wants me to go back and look at anything before or as I take questions. Let me see if there's anything. You're welcome to put questions in the chat or kind of unmute. And if you want to turn your video on to ask your question, that's also totally okay. Any questions at all? Oh, I see one maybe. So there's a question in the chat about when the internships start. This is where there is a little bit of flexibility. Typically, we do an orientation. That's usually either late April or early May. And then I'd say most of our interns typically start in May, sometime in May. That's where it can be a little bit negotiated with your preceptor and your location on when that is. CDC placement is often a little bit later in May. That's been my experience the past several years. That one starts more towards the end of May. So I think it's somewhat negotiable with your preceptor, and I'd say it's pretty negotiable with your preceptor, but within reason. And then, I think most of our preceptors do also understand that it is, summer, and, as long as you're communicating with them, if you have a vacation or want to take, a little bit of time off in the summer, I think as long as you're making those plans up front with your mentor, that they're also flexible with that. Let's see. So Taylor might be able to speak to this too. We've had interns do, it really varies the types of projects that they're involved in. Some of our students have been, and interns have been more involved in some of our research projects where maybe they've been involved in, some data collection or recruitment. Some interns have put together maybe kind of some planning around a project, written kind of protocols for a project. We've had some students do some policy related work, help with a policy analysis. Taylor, do you have ideas?
Yeah, it's kind of a variety. There's, research-based projects, more practice-based projects, projects across all different injury area topics. I did put in a link. Oh, I'm sorry, I didn't go through. Let me resend that. I'll put a link in the chat that shows some of our interns' past projects that they've worked on. So I think if you go through those, you might have a better idea of some of the types of projects we've had in the past.
I know some of the CDC placements have been, some have been more epidemiology in a sense based and a little bit more data based, but we've also had students work on other types of projects as well with the CDC. And there may be some examples on the website as well for that. Any other questions? So resources for housing, I think I believe they have some ideas and can provide some information about areas to live or places to live. They don't provide housing as far as I know, but I do think there's opportunities potentially to connect with other interns as well. Taylor, have you heard from past? It's been a few years now since we've had anyone go.
Yeah, I'm not sure exactly. The past couple of years have been virtual, so I'm not sure what they've been doing.
Yeah, I know they don't, I know they don't provide housing, but they may have some resources around, where to look for housing.
And I think we might have some funds available to be able to help with that too. And I think, yeah, like you said, I think they give some ideas of nearby housing options.
And I know, the CDC has a number of different internship programs going on. So they have a number of students, working at the CDC over the summer, and including interns from other injury prevention research centers. So there may be also ways to, connect with other injury prevention kind of students, interns that are going to also be there around thinking about whether it's shared housing or just, housing in similar areas or other ideas for housing. Emory is not far from the CDC, so I think there's likely student-related housing kind of around there as well. We may, I don't know, Taylor, if you've heard more about what they're planning this year for placements, if virtual or in person.
I haven't. Nicole's on this call, but her video is not working. She just messaged and said that this year they are planning mostly virtual.
Okay, so that I guess is helpful to know, is that likely, it sounds like likely if it's going to be a CDC placement, it will be a virtual placement. So thank you, Nicole. Any other questions? I can also reshare if anyone wants to see any of the eligibility or application requirements, but that's also on our website. And maybe, Taylor, do you want to put the link to the webpage in the chat too? And we have had, interns from a variety of different programs in the past. A lot of our interns are MPH students, either in health behavioral health education or, but also in epidemiology and biostats. we've had interest in the past. We've had students that are doing kind of the dual degree with social work. We've had public policy students that have been interested. So we do and are open to, students in a variety of kind of different programs. So. Okay, well, we can wrap up if no one else has anything. But please feel free to reach out if you have any questions as you're working on your application. And applications are due again on December 18th. Let us know, if you have any problems with the application materials or submitting your application, but it should be pretty easy and straightforward, hopefully. And I hope we see applications from all of you.
Thanks, everyone.